You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Leymiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. A lot of people seem to be under the impression that sex is just easy for men, but that's not really true. When it comes to sex, a lot of guys are carrying around a lot of anxiety and worries. For example, am I lasting long enough? Is my penis big enough? Will I even be able to get it up? These are questions that can eat away at men's confidence, which can lead them to avoid sex or to have sex that's less than pleasurable. So in today's show, we're going to dive into what guys need to know in order to feel more confident in the bedroom. We'll explore what sexual confidence really means, discuss the truth about testosterone, debunk common myths about men's sexuality, and consider practical ways to increase your sexual stamina. I'm joined once again by Dr. Joshua Gonzalez, a board-certified urologist who is fellowship trained in sexual medicine. He is a sexual health advisor to Astroglide Lubricants, and he is one of the co-founders of the sexual wellness brand Popstar, which creates science-backed products to support male sexual health and pleasure. This is going to be another fascinating conversation that you won't want to miss. Stick around, and we're going to jump in right after the break. Are you looking for a space that celebrates diverse perspectives, explores new frontiers, and brings all of your favorite people together? The annual Sexological Conference, hosted by Sexual Health Alliance, is where sexuality leaders gather. This conference connects you with world-class experts, leading sexuality companies, and a community of like-minded, passionate, and welcoming professionals. You'll find your people at the Sexual Health Alliance Annual Sexological Conference this October. Get your ticket to be inspired, educated, and empowered. Note that this conference is open to anyone and everyone. Head over to sexualhealthalliance.com, select the annual Sexological Conference page, and save your spot today. If you love the science of sex as much as I do, consider becoming a friend of the Kinsey Institute at Indiana University. The Kinsey Institute is the world's premier research organization on sex and relationships, and you can help them continue the legacy of Dr. Alfred Kinsey, whose pioneering research changed everything we think we know about sex. Visit kinseyinstitute.org to make an impact. Your donations can help support ongoing research projects on critical topics. You can also show your support by following Kinsey Institute on Facebook, Twitter, and Instagram. Thank you for supporting sex science. Okay, Josh, let's talk about increasing men's sexual confidence. So as a starting point, let me ask what sexual confidence means to you. I think this is a good place to begin because confidence might bring a lot of different things to mind for people. So for example, it could mean feeling good about your body, feeling empowered to ask for what you want, not feeling shame about your sexuality, feeling able to express your boundaries, or maybe feeling like you're a skilled lover. So how would you define sexual confidence? What does it mean or look like to you?
Yeah, honestly, I think you just summarized it pretty well. I would agree with all of those points. And I think it's something that is so individualized, right? I think sexual confidence could mean all of those things to lots of different people. Personally, I would say sexual confidence to me means feeling good in my body, feeling like my partner is getting satisfaction and pleasure from sex, and feeling no shame in whatever activities we're engaging in together.
Yeah, I think there's not one right definition of sexual confidence. I think it can mean quite different things to different people. But any way you look at it, a lot of guys struggle with feeling confident in the bedroom. And so, when it comes to sexual confidence, it's this complex, multifaceted thing, but we need to recognize it isn't all in your head. It's also about how your body responds in sexual situations. And our bodies don't always do what we want them to do during sex. So for example, you might find it difficult to get aroused sometimes, or maybe you'll lose an erection occasionally, or you won't have an orgasm. And these things, even if they happen just once, can be really devastating to a guy's confidence because then they start worrying that this thing is going to happen every time they go to have sex in the future. So as a doctor, talk to us a little bit about this and how we need to normalize the fact that the body doesn't always do what we want it to do, and how we need to stop letting the occasional sexual disappointment totally wreck our confidence.
That's a tough one, because I think it's very easy to tell someone like, oh, it just happened one time. Like, don't get in your head about it, or just relax. You know what I mean? But as we know, you can also tell someone to like stop being depressed or not be anxious, right? Like, it's something that happens unconsciously in our heads without our really being able to control it all the time. But what I would say is having conversations with people to help them understand that problems with sexual performance are incredibly common. I mean, if we're talking about something like erectile dysfunction, we know that it goes up by about 10% with each decade of life. So like in general, we say 20% of men in their 20s experience ED, 30% of men in their 30s, 40% of men in their 40s, and so on, right? So if you're in your 20s, it does not mean it is impossible for you to have erectile dysfunction. It can happen. So I think helping people understand the numbers of how common these things are is helpful, so that they don't feel alone or that the only ones that this has ever happened to. Number two, helping them understand that there are lots of factors that are important for the sexual act to be able to be completed, right? Like, you have to have good hormone health. You have to be well rested. You have to be generally healthy in terms of like diet and exercise. You have to have good blood flow. You have to be in the mood, not be stressed out. Like, there's so many different factors that influence whether or not we're going to be able to perform well. And some of those things we can control and other things we cannot. So I think helping people understand that is important. Thirdly, just helping them understand that sometimes, despite our best efforts at stress reduction and eating healthy and exercising and trying to sleep, we're all in a battle against time. And things like hormone health, cardiovascular health naturally deteriorate as we age, and they can start to play a role in how we're able to perform. So I think all of these things kind of help normalize how common bad sexual performance or poor sexual performance can be. And I think that can be helpful for people.
Again, it's important to have realistic expectations for what our bodies are going to do, and also just how sex is going to go. You know, we've talked before on the show about adopting the 85% rule when it comes to sex. Like, roughly 85% of the time, sex is going to be good, maybe even great or mind-blowing. But the other 15% of the time, it's not going to be great, and maybe it'll be dysfunctional. You know, this is normal. Everyone's going to experience sexual problems from time to time. It doesn't necessarily mean that you have a full-blown sexual dysfunction. Sometimes people do, but it is very common to have those occasional performance issues. And we need to try to find ways, I know it's easier said than done, to not let them totally wreck our confidence.
Yeah. I mean, I think one thing that just came to mind too that we didn't even touch on is sex also involves other people, right?
Yep.
So you may have had a bad performance because of an interrelationship issue, right? Or maybe you're fighting with your partner, or you're not attracted to your partner, or you drank too much, or, you know what I mean? Or they're having pain, or, you know, there's this interrelatedness aspect as well that can definitely make you have, you know, a less than stellar performance.
Yeah, as we've said before many times, sex is biopsychosocial. It is very, very complex. And so it makes sense, like, that lots of little things can happen that can undermine sexual performance. So a lot of what harms men's sexual confidence are the myths and ideas that they're carrying around about things like how big their penis is supposed to be, or how long they're supposed to last in bed. And I think a big part of boosting confidence is about discarding all of that performance pressure and, you know, not comparing yourself to porn stars, right? So what are some of the myths and misconceptions about sex that you think we need to do away with if we want to build up our confidence?
A few big ones would be penis size, right? Like knowing what is a normal or average penis, not what you're seeing in porn. There's a reason. I had a conversation earlier this morning with a patient like that who commented that he thought his penis was small. And he was saying it was because of the penises he sees in porn. And I asked him what he did for work. And I said, well, you're in that line of work because you're a creative person, and he was an architect, and you can render drawings and these sorts of things. I said, why do you think people are in pornography? It's because they have certain talents that are just different than yours. So I think knowing what is average in terms of size is an important thing for people to understand. What is average time to ejaculation or to completion of sex is important. So it's about 5 to 7 minutes from start to finish, right? Which a lot of people don't understand. I get a lot of people coming in thinking that they ejaculate in 10 minutes, that they have premature ejaculation, right? And so just, I think, helping people understand those realities kind of shift what they should start thinking about as having more confidence. Hopefully helps them have more confidence because they probably fall within that normal range in most cases.
Yeah, I think that's so true. So much of what we think we know about sex comes from porn because porn is kind of the default form of sex education, but porn sex isn't real sex, right? It doesn't reflect the reality on the ground in most people's bedrooms. And so, when we're always comparing and measuring up to what we see in porn, it can lead us to have some mistaken ideas and to feel some unnecessary shame and anxiety about our own bodies or our own sexual performance.
We forget that there are camera operators, there are lights, there are directors, there are scene performers, there are assistants in the background, there are camera movements. So that 25-minute scene probably took hours to film. People are taking breaks between those. They are sometimes using medications to get camera ready. That might be pills, they may be injections. So we just sort of forget that. We just assume it's reality because we're in the moment, we're sort of turned on by what we're seeing, forgetting that this is a completely produced false environment. And so I think helping people remember that is important. And I see it also in terms of like ejaculatory health, people wondering like why they don't come as much as the performers they see on film. And there is like an average ejaculate size that we can talk to patients about, which is, anywhere from, I would say 2 to 5 milliliters is considered normal. But they also have fake ejaculate that they use in porn. And so what you're seeing being ejaculated is also probably not really representative of even that actor in the scene.
Yeah, it might be some facial lotion that is shot out instead. This does happen sometimes.
Apparently they sell like fake ejaculate at sex shops. So someone, a performer recently told me, and he was like, "Oh yeah, we use it in scenes all the time." I was like, I had no idea about that.
Yeah, and apparently you can also make your own at home. I actually talk about the recipe for it in my book, Tell Me What You Want. I don't remember how or why I ended up making it into the book, but, it just involves mixing some water and cornstarch. So yeah, I mean, there's all kinds of ways to make synthetic ejaculate. But let's talk about testosterone, because this is something that we're hearing more and more about as part of men's self-confidence. Social media is full of posts and advertisements talking about low testosterone and the importance of boosting it. And now we have this whole generation of men who are convinced that they have low T and that they need to boost their testosterone if they ever want to attract a partner or be good in bed. But what's the medical truth about testosterone? How many guys actually have low T? And, is more testosterone necessarily better for everyone?
I'm not sure if like number wise that I can give you data on like the number. It's 30 plus million men that have low testosterone. I don't know the exact age breakdown of that. It is a problem that is increasing as time goes on. There's data that have shown that the average testosterone levels in my parents' generation, so let's say like Gen X, is lower now in millennials than it was, say, 30, 40 years ago. And it seems to continually be going down. So that is not a trend that we love seeing, right? That we know that men are probably going to be coming in more commonly now at younger ages than they would have 30 or 40 years ago. The same is true for semen health, right? So sperm counts global, and these both are global problems. This is not a US problem. Sperm health is going down, number of sperm, concentration, motility, like quality of sperm is going down globally, which is not great for a race of people to continue to populate the planet, right? And it probably means that there's something environmental going on there. I don't think that we have an answer as to what exactly that is. It's probably a multitude of factors. So it is a common problem and it is increasing with time. What I would say is that we don't really have a good screening process at this point. There's not any recommended screening guidelines to start, say, when a guy turns like 25 or 30. And we don't have good age-related like normal ranges. What we do is end up using a pretty wide range for all men, starting from adolescence to essentially death. The reason that's problematic is that if you get a 25-year-old guy who's coming to you with fatigue, low sexual desire, problems with his erections, depressed mood, anxiety, trouble concentrating, brain fog, all of these are commonly associated with low testosterone. And his testosterone is 300. It might fall within the normal range of the lab that you're using, but it's on the very low end of the normal range. And he probably would feel a lot better and function a lot better if his testosterone was in the higher end of that normal range. So unfortunately, we don't have good guidance in terms of like when we should start screening men. But if you are experiencing any of those symptoms, I would certainly inquire about getting a testosterone level checked and seeing if you might benefit from treatments that could raise that number. Where I think it becomes a little problematic is with like a lot of social media advertisements and those sorts of things. You mentioned something about like men feeling like they need to be on testosterone to, say, attract a partner. I would never put someone on it for that reason. I think a lot of the advertisements that are geared towards younger men online about testosterone probably are more harmful than they are good. But we don't generally put people on treatment unless they're first coming to us with symptoms. I tell my patients, I'm not here to treat a number, I'm here to treat you. And so if we check a testosterone level as part of whatever other screening we're doing, and it's in the low normal range, and I have a conversation with someone and they're like, my erections are great, plenty horny, my energy level's good. If they're not in the high normal range, that's for that person, they're okay. But if that same level comes back with someone who has all of those symptoms, that's when I talk to them about putting them on treatment.
Yeah. And when it comes to testosterone, it's something where more is not always better, right? Because if you're already, let's say high in testosterone to begin with, adding more to the system can actually cause more problems than it solves, right?
Absolutely. Yeah. I mean, we see that a lot with anabolic steroid use. So there's steroid-associated sexual dysfunction. There are men who use steroids who have testosterone levels in the 3,000s, 4,000s, right? Who are developing erectile dysfunction, develop chronically low libido. We're not even talking about fertility, but being on super therapeutic levels of testosterone is going to shut down your sperm production and make having children incredibly difficult, even if you get off the stuff later. I've had patients report decrease or complete lack of sensation in their penis. So what I tell patients is that our bodies are meant to function normally within a certain healthy range. And when you get too low out of that range, or, on the low normal side of that range, or you get outside too high out of that range, you can have problems.
Yeah. So when it comes to testosterone, if you have concerns about it being low, get it checked with a doctor, and also work with a healthcare professional if you're seeking any kind of testosterone replacement or supplementation, because again, there can be too much of a good thing when it comes to something like our hormones.
Yeah. And I think also because I see so many services offered online for these sorts of things, which seem very convenient, and there's a lot of guys who might be ashamed about even having these conversations. Just be careful, because there are a lot of people that just want to make a quick buck. They're not going to talk to you about the potential risks. I see a lot of men that are put on testosterone replacement therapy that have no idea that it's shutting down their sperm production. And they come to me to try to fix that. And sometimes we can fix it, and other times their sperm does not return. And so making sure that you're having informed conversations about risks and benefits of these treatments, asking how long you may have to be on these treatments, what your alternative treatments may be, are important for people to keep in mind.
So we touched earlier on sexual stamina and how lots of guys have, let's say, exaggerated ideas about how long men are supposed to last in bed, right? So if you look at the average in studies where guys are actually literally using stopwatches to time how long it takes from penetration to orgasm, sounds very unsexy to like literally start and stop your watch, but it's about 5 minutes on average, right? And a lot of men think that they're supposed to last 2, 3, 4 times longer than that because, that's what they see in the world of porn. But when it comes to something like sexual stamina, let's say you're on the low end of it, or let's just say you would like to last longer because you and your partner would both find that to be pleasurable. What can men do if they want to increase their stamina and thereby increase their sexual self-confidence?
So I would say trying to figure out if there is first like a real issue there, right? Like if someone is falling well below that average, let's say they're ejaculating within 30 seconds or, under a minute or two, that qualifies as premature ejaculation. I would definitely seek help from a provider like myself who is trained to treat patients with premature ejaculation, because there are techniques that we can talk about. There are barrier methods we can talk about. There are numbing sprays we can talk about. There are medications that we can talk about. So for those patients, I definitely think seeking help from an expert can be really, really helpful. If you're talking about someone that falls within that average and they just kind of want to last longer to have more pleasure or be more connected or create more intimacy with their partner, I don't know that those patients necessarily need to be put on medication. You can talk to them about what do they think sex is? I think that's a good place to start, right? Sex to a lot of people means penetration, but we know there are lots of different ways to have sex, right? So you can prolong the sexual experience and time to ejaculation by trying different types of sexual activity. So that can be helpful for patients to understand. If they would like to last longer from an intercourse perspective, using something like a numbing spray can be helpful also, because it just makes the penis less sensitive. So it takes more stimulation, longer stimulation to achieve ejaculation. So I think those can be helpful. Those are probably the best options, because I don't think those kind of patients really, where people need to consider things like medications.
I agree. So in the last episode, we talked all about penis size and whether there's anything you can do to increase it, because anxiety about penis size is a big factor that impacts men's sexual confidence. So for anyone listening who hasn't checked out that episode yet, you know what your next listen is. But outside the realm of penis size, there are tons of products on the market that promise to give you firmer, fuller erections and to enhance your confidence. So for example, you have things like shockwave therapy and the P-shot, where you have platelet-rich plasma that's injected into the penis, both of which purport to improve erectile dysfunction. So what do you think, with these growing novel treatments out there, can they actually work to improve your confidence and performance?
I think certainly shockwave can. So we do a lot of shockwave therapy in my office. We use a device that's based on a German technology that has been well studied and documented for over a decade now in Europe, which has been shown to improve mild to moderate erectile dysfunction. So I think you have to also carefully select patients for these kinds of modalities. I never overpromise. I talk to patients. First of all, we do a kind of full diagnostic workup to figure out why someone's having erectile dysfunction, to determine whether or not they're a candidate for shockwave therapy. Then I talk to them about what they should expect out of the treatment realistically. And that depends on where their baseline is. But I would say that, shockwave therapy has been shown to improve blood flow. It's been shown to reduce corporal fibrosis, which can help improve overall erection tissue function. And so when guys start to notice more spontaneous erections, more morning erections, or they can get harder easier or maintain their erection easier during sex, that helps their confidence. So I certainly think a treatment like shockwave therapy can be incredibly helpful in improving confidence. PRP, I think, is a little hit or miss. I'm not a big believer in one-off PRP injections. I don't think they do much. I don't think there's any data to support that they do anything. I don't think it's going to harm anything, but where we use PRP in our practice is often in combination with other modalities like shockwave therapy. So for certain patients, I have found that combining shockwave therapy with PRP has a synergistic effect. So if someone has a poorer baseline, they're starting off with more against them, say from a vascular perspective, I will often talk to them about potential for enhanced benefits of adding PRP to shockwave. But I think it's wasting your money to just do a one-off PRP injection here or there. And I've had patients who've had those treatments elsewhere who come to me saying, like, I didn't really notice much. And then, as we talked about in the other episode, we do use PRP in conjunction with other types of particular protocols to increase size. But that's a very gradual process over time.
Yeah. So for a lot of these issues that affect men's sexual confidence, speaking to a professional is really going to be, I think, the optimal way to address a lot of the more serious and severe sorts of issues. But how do you go about finding a doctor or therapist who really knows their stuff when it comes to sex? And I ask this because, what we see in the data and research is that on average, doctors get about 10 hours of sex education across their 4 years of medical school. And, if you really want to know everything you need to know about sex, to be a sexual health medicine specialist, you got to have some advanced training. So how do you find somebody who knows their stuff?
So there are a couple societies that focus specifically on sexual health. One is the Sexual Medicine Society of North America. That has a provider directory. So you can go to like smsna.org. It's a academic society that I have belonged to since I was a resident, which has now been a long time. There is another society called the International Society for the Study of Women's Sexual Health. We call it ISWISH, that focuses specifically on female sexual health. I'm also a member of that organization, have been for a very long time, formerly on the board of directors. Those two organizations are also fall under the umbrella of the International Society of Sexual Medicine. All of these are academic-based societies that are focusing, doing research, recruiting practitioners who want to focus on sexual health. So I would say those are good places to start. I think all of those organizations have provider directories where you can look people up, and they're multidisciplinary societies. So you're going to find therapists there, you're going to find gynecologists, you're going to find urologists like myself, sex therapists, neurosurgeons actually are an SMSNA. So there's all kinds of providers that all have a specific interest and focus on sexual health. So I would say that's probably the best place to start. You have to be careful if you're just Googling, because someone might have paid a lot of money to get up on the rankings for whatever keywords you're typing in. So that might be helpful, but I would probably cross-reference that with some of these other academic organizations.
Yeah, I think that's great advice. And one last question for you. So, we've talked about some things that guys can do to build up their sexual confidence, but are there any practices or routines or mindset shifts that you'd suggest, not just for building up confidence, but, keeping that sexual confidence strong for years to come?
I would say just constantly reminding yourself of what is average or what is normal. I think it's just a helpful thing to kind of go over it, because we're just so inundated with images and visuals and from, not even just porn, just like general media about like what normal sex is supposed to be. And it is very often not reflective of reality. So I think a way to keep your confidence is to kind of just remind yourself of where you actually stand on that normal range. And then two, I think like if you have a regular partner, talking to them, communication, I think is incredibly important in sexual relationships to make sure that the other person is enjoying themselves, because I think a lot of people derive sexual confidence and confidence in the bedroom from what they perceive their partner is experiencing.
And one thing I would add to that would be, I think confidence in the bedroom has a lot to do with your confidence out of the bedroom. And I think there's lots of things that you can do in everyday life, from, diet and exercise to getting good quality sleep and stress reduction and monitoring your substance intake and alcohol use and all of these other things that, when we generally feel good outside of the bedroom, that's going to help in terms of building up our confidence inside the bedroom. So, paying attention to those lifestyle factors, I think, is really important too.
100% agree.
So thank you so much for your time, Josh. It was a pleasure to have you here. Can you please tell my listeners where they can go to learn more about you and your work?
Yeah, so I'm on most social media platforms, primarily Instagram, TikTok, YouTube, at Joshua Gonzalez, MD. My website's also, I think, incredibly helpful at learning sort of what I do, the services that we offer here. There's a blog on that site. It's just joshuagonzalezmd.com. I'm also co-founder of a sexual wellness brand called Popstar. We have an ejaculatory health supplement to help promote ejaculatory health, as well as a delay spray that we just launched to help guys last longer. And that's popstarlabs.com. I work really hard, both with my personal brand and with Popstar, with a team of people to help to really provide sex education in like a fun, informative, disarming kind of way. Because I think a lot of people carry a lot of shame when they're not performing the way they want to. And our goal with my brand and with Popstar is always to help people understand what is real, what is normal, and just how to increase their confidence in the bedroom.
Love all of that. And I'll be sure to include links to all of that in the show notes. So thanks again so much for your time. I really appreciate having you here. Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.